Hi, I'm Nurse Barb, and this is your daily dose on women's health and the most common questions women have about their breasts. You know, our breasts are something we carry around with us every day, and yet there's so much mystery surrounding them, and women have a lot of questions and oftentimes don't really know where to turn. And breasts come in all shapes and sizes. Whether we wear a bra or we don't, sometimes our breast tissue can cause pain and discomfort. Sometimes there's things on our breast tissue that we're wondering about. And one of the things that happens a lot for me is I get phone calls from patients who say, I've got these weird lumps on my breast and I'd like you to check them out. Or they'll say, you know, I've got some swelling under my arm. What's going on? So I don't have a breast model to show you, but what I did find was I found a little cookie in a round shape, and I've adapted it with a gumdrop to show you a nipple. And then I used some makeup here to try to represent breast tissue, and this would be for a white woman. So when we look at the breast tissue, right, if we're looking at it straight on, you see the breast tissue here, you see the areola that surrounds the nipple, and here's the nipple. And then you see these little dots all the way around. These little dots are Montgomerystubercles, and this is one of those issues that comes up all the time. I get a lot of calls from teenagers who say that these are swelling and that they've got them on both sides of their breasts, and they're wondering, are they mosquito bites? Are they breast cancer? Is it a tumor? And what's going on? Well, these Montgomerystubercles, which are like the face of a clock around the areola, these provide lubrication so that when a baby is breastfeeding, it makes natural lubrication for the areola and for the nipple. And you can see that I put a little gumdrop here to show you the nipple. So when we think about the breast, the areola is the area that a baby's mouth goes on to suck. And when the baby is suckling during breastfeeding, the areola actually sends a signal to our brains to make prolactin. And prolactin is the hormone that makes milk. And for babies, usually with breastfeeding, babies need to suck for 3 days to tell the brain to make enough prolactin to make milk. That's why when babies are first born, the first milk is called colostrum, and it's not dependent on whether or not a baby has been suckling or not. Now, the Montgomerystubercles provide a lot of lubrication for the areola to keep everything healthy. But I'd like to talk to you a little bit about other things you might find on the breast. Some women are freaked out because they have a lot of hair on their breast tissue. Well, remember, we have hair all over our bodies, including areas we don't really want it, like our chin or our upper lip. So we can have hair on the nipples. This is not a problem. It doesn't cause any issues for you. But that hair can get quite long if it's not removed by plucking or with shaving. It doesn't harm you to remove the hair on the nipples or on the breast tissue, but if you shave, it's going to come back a little bit coarser. What about breast pain? You know, many of us have a lot of breast pain, especially prior to our periods, and yes, it's because of those hormonal changes and imbalances. But did you know that caffeine intake is related to breast pain? That's right. In studies all around the world, when women have a lot of caffeine in their diet from coffee or tea or sodas, the breast tissue is very sensitive to it, and that can cause more breast pain. But the good news is that breast pain is not associated with breast cancer. That's right. If there's breast pain, it's not associated with breast cancer. So caffeine is not one of those risk factors that you have to worry about for breast cancer. Another big issue that comes up with the breast tissue is that it's not just confined to the breast. There's actually quite a bit of tissue under our arms. This is called the tail of Spence, and it's in the axilla or underarm. When does this become an issue? Well, during pregnancy and breastfeeding, a lot of women will notice some swelling of that underarm breast tissue. And it can be very, very scary. It could feel like Is this a lymph node? Is this a breast tissue? Is this a tumor that I have to be worried about? But most of the time, 9 times out of 10, it's just swelling breast tissue as the breast gets ready to make milk. Now, how does this impact a woman? Well, if there's swelling in the underarm, that can compress the blood vessels that help us return blood from our hands and our arms back to our heart. And if there's compression or something that's interfering with that blood flow getting back to the heart, well, our hands can start to swell. Even our carpal tunnel can swell. That's why when women are pregnant, they're more prone to carpal tunnel syndrome, and they're more prone to that when they're breastfeeding because of that swelling under the arm that makes it much more difficult for blood to return from the hands to the heart. And so that swelling can compress those nerves in the carpal tunnel region, and that can cause women to find that they're dropping things. They can't really hold on to things very well. They might notice that their rings are really, really tight or they can't get them off. Most of the time that's from that underarm swelling. So here's a tip. If you can't get your rings off when you're pregnant, put your arms up over your head for at least an hour. You might have to lay on a couch and have a lot of support with pillows. And eventually that blood will return to your heart. The swelling will go down and it becomes a lot easier to remove a ring. If you still can't do it, then get some dental floss. So use some dental floss to get underneath the ring on both sides and have someone inch that ring up with the dental floss so you can get it off of your fingers. Remember, most women who are pregnant, when they end up in labor and delivery or they go in to have their baby, most women's hands are so swollen, very few women are able to wear any of their rings. And I know a lot of women are concerned that people are going to judge them if they're not wearing a wedding ring. But don't worry, we're very used to women not being able to wear rings. And it's important for us not to judge women based on anything, any attribute that they have or they don't have. So when it comes to breast tissue and questions, a lot of women wonder about something called fibrocystic breast condition. They've heard about this. Well, fibrocystic breast condition simply means that the breasts are a little bit more lumpy and bumpy. And when we do a breast exam or our partner feels us or we feel ourselves in the shower, it can feel like there's a lot of small ridges or it feels really, really lumpy. And it can be very scary because we're wondering, well, how would you know if there was a breast cancer? Here's the trick. The breasts are symmetric. They're kind of like a mirror image of each other, right? So they're a mirror image. So if you see something over here, or you feel something here, you're gonna feel it over here. So if you feel a little swelling on one side, check the other side. It's probably there as well. And women who have fibrocystic breast condition, they're also a lot more sensitive to caffeine and they have much more breast pain. This happens to me a lot. If I drink a lot of coffee, my breasts get very hard because I have fibrocystic breast condition. My breasts get more hard, they get a lot more tender, so I've had to switch to decaf. But don't worry, caffeine, fibrocystic breast condition are not related to breast cancer. Well, I hope this answers some of your questions about breast tissue, about whether it's normal to have little bumps all the way around, hair, breast swelling under your arms, and fibrocystic breast condition. And thanks for letting me show you my model, my homemade model with a cookie. If you like this video, please click like and subscribe, and you can go to my blog, nursebarb.com, for more information. I hope this helps you and helps reassure. Take care and be well.